We have just hit, well, a kind of sad, a kind of expected milestone, 1 million COVID cases. 1 million COVID cases in New Zealand. And I would say, amongst the people I know too, those are the people who've reported that they've got COVID. So it could be much higher than that. And deaths with COVID, well, is that a COVID death? I don't know. But it seems to me we are beginning to learn to live with it. We are no longer hanging on every 1 o'clock announcement of spread or people in hospital or in ICU. And indeed, it would seem to me that those numbers are easing. Basically, I don't think COVID is running or ruling our lives or our consciousnesses anymore. Doesn't mean it's not a threat. And I really wanted to get in today a guy who is an expert, very much an expert, and has very much been front and centre in public debate and discussion about COVID. He's Dr. Michael Baker. He is an expert. You doctor or professor, Michael?
Oh, both these days.
Both these days. Doctor and Professor Michael Baker, covering all bases. He's been advising the government on the pandemic, and he is an epidemiologist. And I have to say, Michael, welcome to the platform, by the way. You've had, amongst the anti-vaxxers and those who've been upset and those down at the parliamentary protest, you've had a pretty rough run. You've copped a fair bit of the brown stuff in the last wee while.
Well, Morena, Sean, thanks very much for having me. And yes, I mean, this is a pandemic that's affected all of us. It's been really tough going. And I can understand that emotions are very high about this. The thing I can't cope with is this stream of disinformation. I mean, people saying totally outrageous things that have no science principles. At the last event I was at, someone stands up and says, the world is flat, and this is an anti-vax person. So where do you begin? Where do you find common ground with those kind of beliefs?
All right, I want to get into that. I think that's a really important thing about what has happened in our society and our media across the whole thing. But right now, we've hit 1 million cases. As I said, we've got way more than that because lots of people just aren't bothering reporting now.
Yeah, look, we understand fully. This is under ascertainment, as we say. Probably half the country has had this infection, maybe more. So we always recognise that. And all the numbers about this infection at this scale, you have to be very suspicious of them. I mean, you understand the limitations, and I think just work around that.
Okay. Whether it's 1 million, whether it's 2 million, is that an important figure now, or do we just recognise that COVID's here, it's here to stay?
Yeah, well, look, if this was a virus that behaved itself and didn't change its spots regularly, I would agree with you. I think we'd build up immunity and gradually the threat would fade. Unfortunately, these coronaviruses keep changing, and we've seen those massive shifts. The original variant in the first year, and then Delta was a huge shift, and obviously Omicron is a complete game changer. But
is it? I'm going to be honest. Is it a game changer? Well, because it seems to me a whole lot of people who've had Omicron say it is like the flu, and they do say it's like the flu, Michael. And their lived experience is that some people have gone. Everyone I know, for a start, has gone home and isolated, whether they've notified or not. And we've got a staff member here who, night before last, his wife considered taking him to hospital. He was pretty sick. He didn't go. He's feeling better today. We've got other staff who've had it. They've thrown up. They've had a couple of bad days. But the fact is, the vast majority of people of those 1 million people have not been hospitalised, have they?
No, and we wouldn't expect that. I mean, this is a disease that's only hospitalising a small portion. It's what we call the case fatality risk. That is, if you're a case, your chance of dying from it is now under 0.1%, so less than 1 in 1,000. The problem is that if it infects... Well, hang on,
just let's interrogate that figure. Less than 1 in 1,000 people who catch this are likely to die. Is that to die?
That's right.
Okay. Can you make a comparison with another disease that is established in our communities? What does that compare with?
Well, it's very much like seasonal flu now in a highly vaccinated population. So it's pushed down to that level. That's actually that's good by world standards. I mean, we're managing this disease well. We've got great doctors.
Okay, I really want to clarify and drill on this because that's a huge thing for a lot of people that you've just said. It is literally right now, in terms of its death rate, like the flu.
It is like seasonal flu. And That is only because we're highly vaccinated. Now, in an unvaccinated population, it would be about 10 times more dangerous than the flu. So this is not the flu. This is a more dangerous virus. The good news is the vaccines are very effective at preventing death and serious illness. So that's the difference from the flu. But actually, the other difference is it's far more infectious. So as new variants come through, they will infect a high portion of the population, and they will start to evade our immunity. The other thing is it doesn't depend on winter to spread. The flu is really here for 3 or 4 months of the year. It goes away.
Though early on, I can remember that Omicron does less well in warm environments, right? Or is it or cold environments? There is a seasonal differentiation in the communicability of Omicron depending on temperature.
It's a small effect because remember, Omicron waves hit the southern hemisphere in summer, and they infected. They were very efficient at spreading. I mean, these huge Omicron waves swept across the whole southern hemisphere in the middle of summer. They don't depend on winter.
Okay. The other thing is people aren't, and I'm not going to name names, but I know people have got Omicron. They've done the thing. They've gone home. They've isolated after they've done their rat test. They haven't told anyone. They're not in the official statistics. I want to ask you, under our current legal settings, and I know we're in some sort of or health officials now have all sorts of powers over us that they wouldn't in the normal course of events. Are you breaking the law if you don't tell someone in the health department that you've got Omicron?
I don't believe so. I mean, this is still, as they say, high trust or voluntary system. Firstly, the critical thing is, and actually Australia did have a system where if you tested positive, there was a big fine if you didn't report it. And that just discourages people from reporting. I mean, in the end, someone has to say, and this is a conscious act, I've got symptoms, I should test myself, I should stay at home. So I think that's really important that people appreciate that. That's a way of protecting the people around them, their workmates and so on.
Is it possible also, and I'm just going to talk from personal experience, we've had a number of people, we've got 25% of our workforce, which gives you a small idea of how that's 3 people, who are off with Omicron, and we've sent them home, and we've got rat tests sitting there, and the deal is if you're feeling symptomatic, you get the test, and if you got it, you're out of here. I have been travelling the country for the last 6 months up and down. I've been exposed to literally dozens of people who have rung me and told me they've had Omicron. I'm rat testing every 2 or 3 days because I'm vital to this business. I can't buy it. Have I already had it? Is there a possibility I've already had it? And I look back to when we went to level 2. The first round, I had 4 days where I was incredibly sick, and I didn't go in and get tested because I knew there was a huge burden on testing facilities. We hadn't sort of got things right then. I stayed at home, didn't see anyone, 4 or 5 days, flat on my back, got up and went again, never got tested, and as I said, haven't caught it when I know logically in some ways I should have, given the people I've been exposed to. Are there people out there that have had it like me and just got through it without knowing?
Yeah, there will be thousands of people in that situation.
Wow. Does that mean we're immune now, that we are we've got a superpower and we'll never get the next variant?
Well, unfortunately, no. That's the big problem with this virus for a number of reasons. One is a biological process. Immunity wanes. Your antibodies drop over time. Yeah. But the big one with this virus is it keeps throwing up these new variants that are sometimes very different from the variant that came before. And now with Omicron, we're getting these subvariants. So first we had BA1, and then BA2 took over from that. Now people who had BA1 are now getting sick within a few weeks, sometimes from BA2. And now there's 3, 4, 5, and it's going to keep going. That is what I find so disturbing about this virus, that's so different from the flu. The flu does mutate, but not in the same way. And that means that we will get these waves of reinfection coming through. And the reinfection may be just as bad as the first infection. And the other problem is long COVID. Now, this is far more common with this virus than it is with influenza. It may be, we don't know, it may be 10%. It does affect children. Vaccination protects you from long COVID, but not totally. And if you get these new reinfections, again, we don't know if your risk is high for long COVID. So these are real problems with this virus.
Michael, we're going to take a break, and then I want to talk about the psychology and those who are pushing back against the sort of information that you're sharing with me today. And I want to talk through that because I think that is a very interesting part of what's happening here in New Zealand right now. We are joined by, well, expert of experts, I'm going to call him, Dr. Michael Baker, who many of you tell me you have heard more than enough of since COVID began. Michael, I've known you for a long time, so when I saw your head pop up on this, I knew you weren't some fly-by-night spin doctor that the government had brought in. Though there has been a whole debate about misinformation and everything else. I'm going to start from something you said earlier. You said, right now, it is no worse than the flu. Now, there have been a lot of people online saying, it's no worse than the flu, I'm not going to get vaccinated. And I'm sorry, they kind of, by what you said today, they're going to grab on what you said and said, oh, we were right, we told you it was no worse than the flu. The other thing that most often people who are resistant to the imposition of dealing with a pandemic say is, and what's our death toll? Death with COVID. What is our death with COVID rate right now? The numbers, the raw number now. What, about 870, I think it is, or 890? That's death with COVID, and an awful lot of people say to me, that's not death of COVID. Why don't they tell us how many people have died from COVID? Why don't you?
Well, because that will take months to review all of the deaths.
We've been going for 2 years. Are we reviewing like that or not? Have we reviewed the first deaths, whether they were with COVID or of COVID?
I would say they'll be working through them now. Basically, the mortality data takes a long time to come out of the system in a final form, and every one of those cause of death certificates is reviewed by a team at the Ministry of Health, and the data come out. It takes about 2 years before they're all published. That's actually quite fast by world standards. We've got a good mortality review system, and it's because of the complexity of assigning a single cause of death or a principal cause of death. Because many people dying, of course, are older and have underlying illness. So they would have probably lived for longer if they hadn't encountered this virus.
But they were going to die of whatever they had anyway, COVID or not. COVID might have... What did they used to call pneumonia? The friendly or the old person's friend, because it takes you away in a certain way. So look, there's a huge amount of cynicism amongst people who aren't anti-vaxxers, Michael, and they say they see that figure and they see the way it is reported as COVID deaths, and they do feel they're being lied to make them afraid.
I don't think that's correct at all. Now, one thing.
Well, hang on. What's not correct about a headline that says 892 COVID deaths when they're deaths with COVID, and you've just told me that we don't actually have the figures on who has died directly from COVID, and that a whole lot of people, older people, have got conditions which are going to kill them anyway. Maybe COVID sped that up, maybe it didn't. So when we see the media saying 872 COVID deaths, people say, well, they weren't. And we don't have the information to say they were. And people say, I feel like the news media or the government are using that figure to scare me.
Yeah. Well, stepping back a little bit, if we use another, because this is a problem around the globe of working out how many people died from this. So increasingly we're hearing or we're using what's called excess mortality. So that gets around a lot of the coding problems. It says, if we look at the pattern of the last few years, how many deaths do we expect over time? And we look at the excess deaths since the pandemic started. And there are two estimates around at the moment. One is 21 million from Economist magazine. The other is 15 million to the end of last year from the World Health Organization. Excess deaths. So this is what the pandemic has added to global mortality over this period. There were times in the Northern Hemisphere...
And what percentage increases that in general terms in global? I don't know how many people a year die in that same time period. So what percentage increases that in mortality in the world if we do use those figures?
Well, in some countries we can use another measure, which is life expectancy. And life expectancy has dropped by 2 years in some countries.
Which countries?
Russia. And in much of Europe and North America, it's between 1 and 2 years of life expectancy has been lost during the pandemic. Now, New Zealand...
Okay, I want to come back to the figure you mentioned this morning. If we've got these excess deaths, if we take what the world's death rate was before COVID and after, you're saying $15 to $21 million. What percentage increase is that in deaths in the world?
It's a significant... Now, I have to...
No, I don't want significant, Michael. Yes. You're the expert, mate. I want a number. I want a ballpark figure. I'm not going to hold it to you and ask you to write a medical paper on it. But is that a 1% increase in global mortality a year? Is it a 2% increase? Is it a 3% increase? Or is it a 15% increase? You can see that that's an important figure.
Yeah, look, I'm just trying to recall the denominator here. No, it's very significant. It's probably, in some countries, it was 25 to 30% increase.
Yeah, some countries, but globally. And New Zealand. And can we say in New Zealand what it is? What is our Okay, last 2 years, simple, we're only 5 million people. How many people a year were dying of anything before COVID? And has that gone up since COVID came?
No, excess deaths in New Zealand have dropped since COVID arrived.
Okay, so that's a reason that people might feel, and that's, I presume, because people haven't been getting flu, they haven't been sharing other diseases with each other, we haven't been driving so much, we haven't been doing risky stuff because we've been wrapped up in cotton wool at home.
Basically, it's because the New Zealand response was so good, it's pushed down, or it's kept COVID deaths low by world standards, but also it's pushed down deaths from other causes. And you're quite right, influenza and excess winter mortality dropped in New Zealand, it went into the negatives. And so the New Zealand response at this point in time has saved around 2,000 lives up to date since the pandemic started.
Okay, I'm asking for another ballpark. Give me your guesstimate, and I know scientists don't like to do guesstimates. How many of the 800 to 900 people who have died with COVID do you think have died directly or solely because of COVID in the last 2 years?
Well, I don't know, because they need to be reviewed. The other thing you have to remember is that some of the people who died from COVID won't have been counted as COVID deaths. And
yeah, but we've had people who have been shot by police who have been counted as COVID deaths, Michael, for goodness sake. So probably the swings and roundabouts, balance that up, don't they?
Yeah, I mean, generally, with influenza, our modelling efforts, our modelling research has shown it results in about 500 deaths a year. That was something we published a couple of times. We've done it different ways. But, only about 5% of those deaths are coded to influenza. So it's hugely underestimated. So with COVID, of course, there's much more attention on it. So I think the numbers are probably more accurate than they are with influenza. And it's just because often these viruses don't kill you by a clear infection that results in you going to hospital with that actual infection. They kill you by causing heart attacks and strokes because they alter how your blood behaves. They cause clotting, coagulation. That's how they kill you. And COVID-19 affects multiple organs in the body. And so some of the people dying will be coded to something else anyway. Now, because of the swings and roundabouts, you're absolutely right. That happens with these causes of death, where it often is a cascade of events. So I just don't know what the final total will be.
And once again, and I'm not trying to add fuel to the fire of the anti-vaxxers or the COVID deniers or whatever they are, I'm just saying you can understand, and I'm approaching this from a layperson's point of view, there are a lot of things here. We say actually our death rate's gone down in New Zealand. We're losing 500 people a year estimated to flu anyway. You tell me it is, in some ways, when we look at its mortality rate, just like the flu right now. But it seems to me we have had a campaign, and it has been a coordinated campaign. I know the number of people who have been working for the government on pushing out messages about COVID. A campaign that has, and I think rightly, got large numbers of us to get vaccinated. I got vaccinated, no problems with it. I don't know if it saved me from COVID or not, but it hasn't done me any harm, and I feel safer going about my life. But I didn't need to do it because of fear. And a lot of people said the problem has been that they have reacted to a government campaign which has made them fear, or they believe is trying to make them fearful to motivate them to act in a certain way. And a lot of people I talk to say it's not like they just trusted me with the facts and to make a good decision on my own. There was this, it was like a Jaws movie, the shark's in the water, you better get out, you better do this. And I think a lot of people felt in some ways manipulated. And at a time that was difficult for them anyway, they lost some personal sovereignty. We've lost some liberties. And as a result, they've bounced back against what I think underneath it all are pretty logical messages that you've been involved in sharing. So do you think we have overplayed the fear in communicating what is going on with COVID?
Well, I don't think, I think the messaging from the government has been appropriate. I think one of the problems is this incredible focus on COVID-19 when, well, it's now been pushed down by other, appalling global events, conflict and climate change. And some of those things we should be very concerned about as well, of course. So I fully understand. I don't like the idea that there is a lot of fear about this virus. But if you look at, we always think about counterfactuals. What would have happened if we hadn't taken the elimination approach? Now, you look at the disruption this virus caused across the globe in that first year before we had vaccines. I think it was appropriate to take a very vigorous response. I think the government got it right. And if you look across the Asia-Pacific region, places like Australia, New Zealand, Singapore, Hong Kong, Taiwan, all took a very proactive approach. They largely kept the virus out. They pushed cases and mortality from this virus very low, and also we avoided a lot of these other infections over that period, and it produced a great result for all of these countries. Now, all of these countries, I think, are appropriately now that we've got vaccine, shifting to a vaccine-based approach. And remember, I'm only saying that this virus is like seasonal flu because we're highly vaccinated. If we weren't, we'd have wound up like Hong Kong did in the first few months of this year when the virus circulated there. It didn't kill 800 people like New Zealand. It killed 9,000 people.
I'm going to pull you up. It hasn't killed, Michael, 800 people in New Zealand. We've had 800 people die with COVID, and you've just told me it's going to take 2 years to know how many people COVID has killed. And when we get back to misinformation and why people don't trust, it's when you drop something like that into a conversation and you're not challenged on it. Do you agree with me that I'm right? 800 people, we cannot say statistically that 800 people have been killed by COVID in New Zealand.
Well, I'm just reporting the official government number.
Yeah, but I want you, and I trust you as an expert and someone I personally trust. I trust you not to fall into the trap of saying 800 people have died from COVID, because would you agree with me? They have not. We cannot scientifically say they have.
Maybe more than that, because...
Maybe less than that.
It may be less.
Okay, so why do you say it as an expert? You drop it into the conversation like that, and I know all the anti-vaxxers and the people hanging out there on the internet are going to say, oh, that's a lie, and you blow your credibility.
Well, remember that this is the World Health Organization standard case definition.
Yeah, but people don't... I'm going to get real with you, because I think this is part of the problem we've got in this country. Kiwis who live in Eketahuna or Palmerston North or anywhere else and are trying to get on with their jobs, they believe they vote for a government, and that government that they vote for, whether they like it or not, in a democracy, has dominion over New Zealand, right? And what happens in New Zealand is run by New Zealanders for New Zealanders through a universal enfranchisement, right? Through one person, one vote. And now you're telling me that while what I might have just dropped into the conversation casually, and I pulled you up on, oh, that's because some bunch of bureaucrats sitting somewhere in the world say that's the way we should do it. And New Zealanders, I would say a significant minority of New Zealanders, find that incredibly frustrating and have been and are blowing back against it. And a lot of them were sitting on the front lawn of Parliament, rather confused about the details, etc. And every, Uncle Tom Cobley and all were there. But I'm trying to get you to understand, because I know you are a reasonable man, that this is where this tension comes from. Can you see that?
Yeah, well, look, we could have a whole discussion on the coding of mortality. It's a technical area. And look, hopefully everyone understands that every number that's quoted in the health area, because we're complex organisms, there's multiple factors around the question of what we call validity. Are you measuring the thing you're trying to measure? It will take a long time to actually sift through the data to come up with the exact number. Maybe it's only 500, maybe it's 1,000, I don't know.
But you can't sit there and casually drop into the conversation, Michael. This is what I'm telling you, that 800 New Zealanders have died from COVID, because it's simply, on the information we have, it ain't true.
Well, we just simply don't know.
Yeah, so why say it?
Because across the globe, every country in the world is trying to report numbers.
So someone else jumps off the bridge, so we jump off the bridge. What I'm saying is, New Zealanders are looking for their own truth within our country, right? And a lot of people are not buying, oh, we have to do this because that's the way the global system says we do this. And I'm trying to drill down to why we have had problems, and I think we're going to have growing problems with people, if you like, being willfully non-compliant or rebellious about the restrictions placed on us for COVID. Look, would you mind staying, because I also want to move on and talk about the vaccination campaign and the anti-vax thing. Would you mind staying on after the news?
No, that's fine. But I do want to say that basically it will never be exactly 800 deaths. It will be plus or minus, and it will take time.
It'll be a number, but we don't know the number yet, Michael.
Well, you have to have a convention for reporting all of these health events. There's a whole international classification of disease system.
Do you?
Well, otherwise, how do you compare progress over time? How do you compare countries?
We do it within New Zealand, and we say, look, well, we can report it to them on their criteria, and we can report it to New Zealanders on New Zealand's criteria.
Well, this is an interim number. I actually don't think this is really the crux of the issue, because every health statistic you have to take with caution because there's conventions involved. And I think cause of death is really difficult. I mean, most people in New Zealand are coded to certain events, and if they're over a certain age, they won't have an autopsy or anything. So we understand the limitations. All epidemiologists around the world know these numbers have to be thought about very critically. And I'm very critical of all health statistics. But you need some conventions for reporting. We hope we're equally wrong in every country in the world, but at least they're vaguely comparable.
Okay, and I do get what you're saying there. Hey, this is a great conversation. We're going to come back to Professor Dr. Michael Baker, the expert you love to hate, but he's standing his ground, and we're getting through some stuff today. And I know that some of you who correspond me love to hate the experts, but I rate Michael Baker, and he's a guy I trust and have known for a long time, but we're talking about, well, is it just the flu? Michael was just saying to me off camera, what was it? It's not just the flu because. Why is it not just the flu?
Because we have high vaccination coverage, and it's pushed the mortality risk down an order of magnitude. So it would be 10 times higher. We'd have the same experience in a place like Hong Kong if we didn't have high coverage. And Omicron is no safer as a virus, or it's just as harmful as the Wuhan strain that circulated around the world during the first year. So it hasn't suddenly become less harmful. It's because we are more resistant to it because of vaccination.
All right, Michael. Let's look at the vaccination. And I have had, while setting up the platform and not really in media mainstream, the amount of correspondence I've got from people who are saying, you know, my next door neighbour's cousin's wife was working in a factory where the 16-year-old son dropped dead from after taking the vaccine. We've had, to be honest, the absolutely irresponsible, brain-dead rantings of people like Liz Gunn, who's saying 5 kids collapsed in a pharmacy in Rangiora when it just never happened. And I know, because I read what the expected adverse reaction was going to be to the virus, and I know that the Ministry of Health, everyone says they're hiding the figures. No, the figures, you can actually go online every day and see what the adverse reactions were. And every time I had someone, and I engaged with a few of these people telling me the story, I would often ring them and say, tell me about this, this, and this. And you'd ring them and say, okay, did you tell the doctor? What did the doctor say? Oh, they're all corrupt and they wouldn't tell us, or they told us that. Oh, what did the Ministry of Health tell them? Oh, not to report it. You sure? And you'd always drill down, and I'll be brutal. When you analysed it, the stories were rubbish. But there has certainly been that narrative is swirling round out there on the internet. So before we talk about the number of people who got vaccinated, what are the adverse effects? And can you quantify how many people have had permanent damage or died in general from getting the vaccine?
Yeah, well, you're right that adverse effects of vaccine are monitored very closely. They're extremely important that we understand them, because we're giving this vaccine to millions of healthy people, including children. So everyone wants the vaccines to be safe, and that's a starting point. The companies don't want to market something that's going to harm people and kill them.
But they're okay, because haven't they cut a deal with the government that they're not liable for the problems caused?
Yeah, look, they have some protections there.
Why? Why did they need those protections?
Well, I think it's the arrangements under which they work internationally. Now, I'm actually outside my area of expertise.
Yeah, okay, yeah, I know.
I haven't worked in this particular space, so you should interview someone who, like Helen Producers-Harris, who works on adverse events.
Yeah. But you're saying that from your working knowledge of it, and you're not a person who doesn't know this thing, have the adverse effects, as far as you know, been within the parameters or the expected parameters?
I think so. And I mean, with the Pfizer vaccine, the big concern, of course, is myocarditis, pericarditis. And unfortunately, 2 or 3 people in New Zealand have died from that. And it's been thought to be related to the vaccine. And they're still being investigated. This takes time. But that is after 10 million or more doses in New Zealand, a lot more than that. So that is tragic. And obviously, no one wants any deaths related to vaccine, but it is clearly possible and does happen.
All right. It seemed to me we got started late on the vaccine roadshow, as it were. And this was a crisis, and I think I saw health officials, government, business, everyone in New Zealand having to react in the moment to a rapidly unfolding set of circumstances. Firstly, can I ask you, do you think we were a little slow in getting our minds into the vaccinate sort of mindset as a country and as a government and as a people? Well,
it would have been great if it was earlier, but I actually was not involved in that process.
Yeah.
But in the end, New Zealand is a small player in the global vaccine market, and there were countries who were producing these vaccines who understandably were at the front of the queue. I don't know all the details. Australia and New Zealand were relatively late to vaccinate highly, and I think part of it was because the people were not dying in large numbers.
Because we could close our border and largely keep ourselves safe by living, as John Key would say, as the hermit kingdom, right? So I guess too morally we had every reason to be a bit further down the queue. We weren't at the front line, as it were.
That's right. I mean, in many ways, the countries that needed the vaccines were ones that were not in the position that they could keep the virus out. And you're looking at most of the world, in fact. The vaccines were saving lives on a daily basis in those countries. So in the end, everyone knows the sequence of events in New Zealand. By the time we had widespread virus circulation, it wasn't actually until February this year with Omicron. We had obviously Delta, but its circulation was very limited. And that was tough because, of course, it meant Auckland had a long period of lockdown, and we know the history of this. So there were consequences for New Zealand, but in the end, by the time Omicron circulated, we had very high vaccine coverage, particularly in older New Zealand, and also our aged care sector was very organised to protect very vulnerable people. And as a result, we have a lot more of our parents and grandparents who are alive now who would have died if it hadn't been for that sequence of events. All
right, and I am prepared to accept that. And we have got, what's our vaccination rate now? Michael, do you know?
Yeah, for our adults, it's around 96% fully vaccinated. It's a lot less than that who've had their booster. I think we've got about 70%, I think. So we've got about 900,000 adults who haven't had the booster.
Okay.
Now, 2 doses of vaccine was fine for Delta. It's not enough for Omicron. You need the 3 doses.
Can I get a 3rd dose now? I think I got double, second shot January 19th or something. Am I due for another one?
Yeah, well, you need it was called the booster, but in reality...
It was a whole new vaccination.
Effectively, your primary vaccination for Omicron is 3 injections of vaccine. And after that, if you're older, and I think the government will announce this probably quite soon, they're certainly looking at a true booster, for people who are older and have immune suppressive illness.
Okay, and that's
really
me.
Benefit.
That's good. That's me. I'm all at risk. I smoke. I've got type 2 diabetes. Yeah, just terrible. Don't know why I'm not dead yet. Michael, I want to go a little bit broader now. There is no doubt that our response to what in our lifetimes, we're roughly the same age, is probably the single biggest global event. I think you could look at 9/11, but in real terms of every aspect of living anywhere in the globe, really, COVID-19 has been, if you like, our war. It has been the biggest thing, I believe, that's happened in our lifetime. And I tried to look back, end of apartheid in South Africa, fall of the Berlin Wall. No. COVID-19 a global pandemic in our lifetimes for people who have lived post-World War II. This is it. And I think it's done an enormous, and I was going to say amount of damage, but that's a value call. It has changed our society. I talk to people in business, and it has changed. A lot of people have gone to the wall. A lot of industries are struggling. I look even, Michael, at something like rugby. And 2 years of Super Rugby not having a competition, and you look now at the viewership numbers for a Super Rugby season, and we have got out of the habit. Some parts of our cultural landscape are forever changed by this interregnum we've had for 2 years, because people couldn't travel, because people had to distance from each other. And I think there is a huge feeling amongst people that they want to somehow recapture how we were before COVID-19. Do you think we can go back? And do you think, I mean, I'll say personally, I just want these masks to go. Everyone I know who's caught COVID has worn a mask everywhere they should. And it hasn't stopped them getting Omicron. So why can I walk into a bar or restaurant, hug someone, have a beer with a mask off, but I can't go to the supermarket without a mask off? Why do I have to tap my pockets every time I walk into a dairy? And I'm sorry, I just think a lot of people are, in a psychological way, over it. Can't we take our foot off the accelerator a little bit now?
Yeah, I think we're all over it, and we wish it would go away. Unfortunately, it's not going away at the moment. That's the difficulty. And I think if you are in a more vulnerable group, particularly if you're older, your immune system does not work as well. And there's a term, immune senescence. It starts to decline. And even if you're vaccinated, you are more vulnerable. So this is, unfortunately, a decision that people are going to have to make.
Yeah, well, what I'm saying is what they're feeling right now, Michael, is that you're making the decision, and a bunch, I'm sorry, and I'm not being rude to you personally, I'm talking about perceptions out there, is that a bunch of people in a lab in white coats who are obsessed and have been their whole lives because it's their career about how the data comes in and how it looks like in a lab, they get the feeling that they're being run by people who don't live their real lives. And I would say life is full of risk. I am going to have to die of something, probably one of the comorbidities I already have. And I don't expect the government or the health department to save my life. I don't think you can keep me alive forever. And I think part of living a full life and a rich life is that we accept there is risk in it. Because you know that scientifically and perfectly, if you want everyone to survive and have the lowest death rate possible, we would all be living in little bubbles forever, right? And we'd only have couriers in hazmat suits delivering, delivering our groceries to us. But that's not the real world. So there is this, perfect theory about epidemiology, medicine, and vaccines in a lab and the data you crunch. And then there's the chaos of the real world and living in a society that is full of blood, disaster, and random events. So can you understand why sometimes you get some blowback and people don't love you? Because they're not scientists and they don't see the world the same way you do.
Yeah, look, I fully understand that. And remember that a lot of the triumphs of public health and the reason that we live long and generally healthy lives is because of a succession of advances that have frequently been resisted throughout history. And you look at now, for example, wearing safety belts in vehicles, putting children in child restraints. A few years ago when people looked at the indoor environment and said, actually, people can't smoke on aeroplanes and in restaurants anymore.
Those were the good old days, yep.
And look, people regarded those as a shocking infringement of their rights at the time. Now, would we want to go back there? Would we want someone lighting up a cigarette or a cigar next to us in a restaurant?
God, I would. I'd love it.
Yeah. So we may agree to differ on that point, but this is a sweep of history is towards, in general, making life safer and more, and giving people longer. And we talk about healthy life. We don't want to extend life when it's no longer fulfilling for people. So this is a succession of advances. Now, historically, we want clean drinking water. Then we wanted safe food, and we got those things. Now we want safe indoor air. And I think one of the legacies...
Well, do we? Or you're telling us that we need it?
Well, I would...
You're almost manufacturing the demand. The government spent millions and millions of dollars on ad campaigns, COVID-19, be afraid of this disease. This is the thing. This is not a natural response of what people say they want. This feels more... And with, the podium of truth at 1 o'clock as it became known, this feels, and many people feel, maybe a minority, but I go back to the people on the front lawn of Parliament, they feel because they have lost their freedoms, they feel they are being manipulated. And they feel they are being manipulated, I'm sorry, Michael, largely by fear. And fear generated by numbers that, as we've discussed this morning, can be challenged and aren't clear and aren't sure.
One of the real challenges in risk communication is to use a framework that people understand and relate to. And I think it's difficult. One of the things also is we have there's a saying in public health, a public health triumph, nothing happened. And it's
like the intelligence agency. Anyone in security says, "Oh, but the stuff we did that you didn't know about." Yeah,
that's right. And of course, you don't want this kind of bullshit happening if it's not true. And so what we try and do is to say, we often think about scenarios saying it's not the best, it's not a great choice, but it's the least bad choice. And often we think about what would happen if certain things did or didn't happen. And I think New Zealand had, if you looked at the first summer and now even the last summer of virtually no COVID circulating in New Zealand, we had a glorious free summers in our country. And that was because we'd kept the virus
not if you're
out.
in the hospitality industry, Michael, not if you're trying to run a business, not if you had supply chain stuff you needed. And a lot of people feel, I'm sorry, Michael, that was largely spin.
Yeah. Well, one of the things is, what would have the alternative scenario have been? Would we have had this virus everywhere for those first 2 years?
Well, we've got it everywhere now.
We have got
and
it
I
now.
think people feel happier and more free than they did a year ago.
Yeah. And of course,
And I think people are saying it's just like the flu. That is the truth of the situation now.
it's
okay?
only like that because of
more than a million people have this.
Yeah. It's only tolerable because we've achieved high vaccine coverage before it started circulating. Otherwise, it would be grim.
Okay.
And you only have to look at Hong Kong that let the virus rip at a point when it didn't have enough vaccination coverage.
All right. So we keep getting vaccinated. When are we going to be able to get rid of the masks? Are we ever?
Well, it does partly depend on your health status. Now,
No, it doesn't. It depends on whether or not I want to live in a country that mandates that I have to wear a mask when I get into a cab or go to the supermarket, Michael. That's what it depends on. And I don't care what my health status is, because I'm walking into a bar on a Friday without my mask on, because I can walk down the street without my mask on, I don't see why someone in the supermarket and the dairy can come up to me and tell me to put a mask on. That's what it comes down to. And see, this isn't a theory. This is how individuals live their lives and how they feel.
yeah. Well, look, we could go back to the safety belt example. Do you feel that it's good that the government requires people to wear safety belts in cars?
Yeah.
And it's very much like that. Now, I think
No, but see, it's not at all. Because a car is an object that moves with this thing, and the safety belt clearly works. I don't see, and I haven't seen numbers that convince me that me wearing my mask into the same dairy every morning where I go to buy my cigarettes, which are going to kill me anyway, saves my life or stops me catching Omicron.
Well,
and everyone I know who has got Omicron and who has caught it has worn their mask in every mandated place they need to, and they've still got it, right?
Well, remember that you can get this virus in many settings, and a lot of the transmission happens in informal social gatherings in people's homes and so on.
Yeah.
So it's you.
But it would be ridiculous, wouldn't it, to tell people to wear masks in their own home?
Yeah.
And it would be an imposition on them as individuals.
Yeah.
So why do it in a dairy or a supermarket?
Well, I think you have to think about situations where it works. And look, the risk of transmission in some of these environments is quite low. I mean, in supermarkets, they've got good ventilation and so on.
So why are we having to wear masks in supermarkets? Are you telling me as an expert that probably there's only a marginal benefit from having a mandate in there?
Well, I think currently a range of indoor environments, there's still a case for it. But really the highest risk environments, unfortunately, people take their masks off. So if you go to an indoor social environment, understandably...
Because we want to live our lives, Michael.
I know.
We can't live in fear forever.
I appreciate that. And I'm like everyone else, I want to get out and socialise. I mean, we all want to do this. So it is trying to retain the most effective and least intrusive interventions. I think masks are tough to get the policy right.
Okay. Are you telling me, I just want to come back to something you said, probably marginal benefit to having a mask mandate in supermarkets?
I think it probably is, based on the history of the number of cases that are getting infected.
Have you advised the government of this?
Well, basically, the government gets its advice from many sources, and I do not know what the final, where mask policy is going to wind up. I think
have you written anything?
valuable.
Have you written anything in your context as an official consulting expert on this pandemic that says masks, we should review masks, and we should look at maybe relaxing the rules somewhere?
Well, no, we've written a lot about revising mask policy because we think it's important in schools, because that's where a lot of transmission's been happening.
Yeah.
So I think all the settings need to be looked at, and we want these things to be proportionate and effective, because people will do things I think it helps if people say, yes, I can see that this will make a difference and it's really important.
Okay. Could we also look at a trade-off where things like masks and other impositions and, I don't know, social distancing, I don't even know what the rules are now, to be honest, Michael. Like a lot of people, I'm just over it and I want to get back to it. If we can keep our vaccination rates high, does that mean we don't have to have all these other impositions on people in their daily lives?
Yeah, well, I think the indoor environment, going back to that, the safety of indoor air, I think we've learnt about that. And I don't think people want to go to an open plan office or a social environment and feel that if there's someone in that close to them who's got this virus, they're going to get it again. Because unfortunately, these new subvariants will do that. It's like you've got the risk all over again. So I think we have to sort out indoor air quality.
Okay, so that's an area we can move on. Look, I think we have been successful in this country. I think it could have been a lot worse, and I think that is largely down to people like yourself. What about the personal toll, just quickly, of the last couple of years, Michael? And as I say, you're one of the most trolled and at times hated and vilified people online. Did you get any training on how to deal with that, and what has that journey been like, quickly?
Well, it has been a shock to see some of the negative stuff coming in, and it is very personal. It's not. They're definitely not playing the ball. They're playing the man, the player, and that I find shocking. But I think what has astounded me is just the lack of grasp of basic science and even logic, and. Of course, the people who contact you, a lot of them give you nice feedback, but I think there's as we know, a very active group of anti-vax, anti-science people. And I don't know how we combat that. I think it's not just in this area, but it's around
I think you combat that by having better answers about how many people have died of COVID. I think you combat that by not necessarily always being bureaucratic about it and understanding that this is more than just the science, Michael. It's about people who are variable, messy, dangerous things sometimes. I thank you. In some ways, I want to say thank you for your service, because I know what you've done and how hard you've been working. And I thank you also for giving us an hour of your time this morning and, just engaging in conversation on the platform. So thank you very much indeed for your time.